Good evening, everyone. I am Emily Elliott, speaking to you from Connecticut, where I am the lead veterinarian at Chippens Hill Veterinary Hospital, a part of the CVP community. On behalf of community veterinary partners, I thank you for joining us for another dynamic VetFuel event and our first clinically focused topic. We are pleased to be partnering with Merck Animal Health for tonight's program, and it is my honor to introduce our speaker, Dr. Byron Blagburn, whose presentation tonight, New Science to Change Your Approach to Feline Parasite Control, will teach us advances that include a focus on feline heartworm infection. The information will impact our approach to feline medicine by challenging us to rethink what we learned in vet school and from our years of experience. I have admired Dr. Blagburn since I first heard one of his CE presentations. He always presents research that improves patient care, so I appreciate that his talk tonight on new science in feline parasite control will both increase our understanding and provide us with innovative treatments we can trust. Dr. Blagburn holds the appointment of Distinguished University Professor at the Auburn University College of Veterinary Medicine. He received his doctorate in parasitology from the University of Illinois College of Veterinary Medicine and is an honorary diplomate of the American College of Veterinary Microbiology and Parasitology. He has been involved with and led several parasitology associations and societies, including as associate editor and board member of multiple veterinary journals. So without further ado, Dr. Blagburn, thank you for joining us tonight.
Thank you, Dr. Elliott, for that kind introduction, and welcome to everyone. Hope you enjoy the presentation. We do hope to present some information that will, we think, influence your decisions about product choices and about controlling parasites that we have had historical difficulties controlling. Let me first say that by way of disclosure, that I do collaborate with many pharmaceutical and diagnostic companies in the form of research grants, sponsored talks, and continuing education. And none of what I'm going to say is influenced at all by their support for our research program. So what Dr. Elliott didn't mention is that I'm a founding member, very proud of the fact that I'm a founding member of the Companion Animal Parasite Council. And many of you folks have used CAPC's resources. I'm showing you now a more recent screen view of our website, and the resources are abundant. You can go there, of course, and look at our prevalence maps and our forecast maps, which I'm going to show you in just a second. You can view our guidelines specifically for individual parasites that we update, edit, and update those guidelines monthly to try to keep up with the sort of changing spectrum of treatments that are out there. We have expert articles on everything from fecal control to heartworm diagnosis and detection of vector-borne diseases. So without spending too much time on it, I would encourage you, if you haven't, go to CAPC's website. There you can predict, or you can appreciate our forecasting strategy, and I think this will help veterinarians across the country in their attempts to convince clients about the expanding geographic ranges of heartworm and other vector-borne diseases. And so you can see here our 2021 forecast that I just finished and we just posted on CAPC. So these are generated based on weather patterns, client use patterns, and parasite prevalences and climate. And it allows us to look at how the distribution of vector-borne diseases are changing and what that risk is going to look like in 2021. We don't intend for you to believe, if you focus up to the left, that heartworm is as common in eastern Montana as it is in east central Alabama. It's not the point. These are risk assessments, and what that red spot up there in eastern Montana and other places, or any change in prevalence, will tell you is that due to the changes in the factors that I'd mentioned, clients and veterinarians should likely pay a little more attention in the coming year to the possibility of those parasites sort of spreading their distribution. And that occurs both for Lyme, ehrlichiosis, and anaplasmosis as well. Everything tends to be spreading outside their traditional or historic ranges, and Lyme and anaplasma specifically moving more southward and westward. So these guys are on the move and will remain on the move. I've been a past board member of American Heartworm Society, and have a tremendous respect for my colleagues at the American Heartworm Society and would like to tout their feline guidelines, which were just updated last year as an additional source of information for you folks if you're looking for details in the biology of heartworm in all aspects of diagnosis, treatment, and management. So what are we going to talk about tonight? Well, certainly prevalence, and we're concentrating on cats, feline heartworm, intestinal parasites, and some ectos. We're going to talk about the fact that heartworm diagnoses are increasing. Why? Well, there is some improvement in tests, some increased attention paid to, I think, to heartworm in general. Some responses to some of the newer research that we've put out there and published. Talk about life cycle and epidemiology. Do we have it right? And the answer is, well, we don't know. I'll tell you that it's quite a bit different than what we see in the dog, and I'll show you evidence to indicate that it's a bit different from what we see in the dog in terms of parasite behavior and disease. Speaking of disease, I'm going to talk a bit about something that my good friend and colleague Ray Dillon and I studied several years ago, and that's heartworm-associated respiratory disease. And I'll explain in more detail what that is and how we arrived at that acronym and gained much respect for what immature stages of heartworm can do in the cat. We're going to talk about diagnosis and what we now know that might change our influences, or might change our approaches, I should say, to diagnosis. But with that new technology and that improvement in diagnosis, it's also brought some problems with us. With it. And one of those is this idea of antigen blocking and reversal that we're seeing all of our laboratories that do extensive diagnosis do, and we'll talk a bit about that. I'll update you on what we know about treatment. It's still the least favorable option. Certainly we still don't have, in every situation, safe and effective approaches to eliminating heartworm from cat, but we will suggest what we think maybe we should do when we see it and how to approach it. It's in the area of prevention that the changes are actually coming. The products are entering the market rapidly in both the canine arena and the feline arena, but I don't think things have changed as much in the canine as they have in the feline arena in terms of the impact, potential impact that these new treatment strategies are going to have going forward. And then we're going to make mention of internal parasites and ectos too, and why they're still important. So this captured my my attention not long ago. What this is it's a survey of veterinarians in the United States in gray and in the UK in blue. So let's concentrate on gray. And what I noticed, and I've highlighted it for you, is that when you ask clients their perception of risk, how they perceive these different parasites as risks to them or to their patients or to their pets, I noticed that in a few categories, there's a disconnect between veterinary response and client response. And I've highlighted that for ticks, hookworm, and heartworm. Veterinarians have a great deal of respect for fleas, always have, and the need to get rid of them. And for the most part, understand the importance of roundworm, although the convenience of treatment certainly has improved. I'm going to use this slide a little later on when we're near the end of our talk, when I revisit the idea of new products and opportunity. What I think this is new opportunity for us. Clients recognize a risk. It's an opportunity that we as veterinarians can take advantage of. So just a couple of words about distribution. I know you guys know that heartworm is most common in the Southeast, most common in dogs in the Southeast. And so what I want to build over the next few slides is a convincing argument for one point and one point only. And that's that wherever you see canine heartworm, you're going to see feline heartworm. Where you see more canine heartworm, you're going to see more feline heartworm. The problem is that we don't have the capability to diagnose feline heartworm infection and disease as successfully as we do for the canine. We'll talk about that. Every state in the United States, including Alaska and Hawaii, it's not yet indigenous, autochthonous in the state of Alaska, but there's certainly dogs that have been moved up there, spotted, that are microfilariemic, so it will not be long, I promise you. So this is a graph, excuse me, that we put together not too many years ago using IDEXX reference laboratory data. And I think it's important because it shows you in graphic form and based on research what I just told you. This is the prevalence of feline heartworm. This is the prevalence of canine heartworm. If you plot one against the other, and these are zip codes, you will get a line that we sort of apply a correlation coefficient to. And so what I've done here is sort of defined what a correlation coefficient tells you. If it's 0.70, there's a very strong correlation between the two items that you're comparing. And you can see the correlation coefficient here is 0.69. So there is, in fact, a strong correlation between when we see heartworm in cats and when we see heartworm in dogs. Just a point added to what I'd said earlier. This is also, excuse me, the results of a study conducted by IDEXX not long ago. These are antibody prevalences, and it's intended to show you sort of the geographic distribution of heartworm and the fact that mosquitoes carrying heartworm and cats that respond by producing antibodies are found throughout the United States. And I've pieced in over here a CAPSI map of California and a CAPSI map of Ohio, just to show you that both CAPSI's data and IDEXX's data point to the same, if not a very similar, distribution of feline heartworm. So it is out there. So why aren't we seeing more of it? We're going to tell you in just a minute. So if we look at prevalence in a bit more detail, the upper graph or graphic shows you results of necropsy at shelters throughout the United States. And the point I want to make here is that prevalences range from 2.5% to 14% in the southeastern United States. So very high in areas where heartworm is common in the dog, an average of about 5%. Let's go down here. So the antibody prevalence is about 12%. And you say, well, antibody is just an indication of exposure. When I teach seniors who understand it better at this point, I tell them, let's try to avoid using the dreaded E word, because a 12% antibody prevalence rate is an indication of infection. When an agent, whether it's a tick-borne disease agent or a mosquito-borne heartworm infective larva are introduced into a host, they induce the formation of antibodies. Whether they make it to the heart or whether they as bacterial infectious agents cause disease or not, they still result in infection. So antibody prevalence is a measure of risk and infection. If you look at antigen prevalence, it's about 1% to 2%. Now we're in cats. So if the average at necropsy is 5%, but the antigen prevalence is 1% to 2%, what's the disconnect? Well, remember that we can recover a single worm or a low worm burden female infection up here that will not kick off an antigen test down here. So this is always going to be lower than this. Now I want to sort of engage you in what I think is very interesting. We're going to talk about heartworm-associated respiratory disease a little later on. This is caused by immature heartworms. No indication of presence of adult worms in the heart or lungs at all. We, Dr. Dillon and I, gauge that prevalence at somewhere around 6%. So if you combine antigen prevalence and HARD infection, these are true heartworm infections in every one of their forms, we place it at about 6% to 8%, which is really higher than many diseases that we worry about in terms of diagnosis, prevention, even vaccination. So I think we ought to start looking at heartworm maybe a little differently in terms of its potential prevalence and how we ought to address it in terms of risk. So what about the life cycle of heartworm? Well, L3 is deposited by mosquito, but the role of the mosquito has a profound effect on prevalence of heartworm, whether it be in the dog or the cat. Let me show you something here. If you take dogs and cats and you expose them to two different species of mosquitoes, a Culex or an Aedes, and you monitor blood feeding habits and detect presence of blood and determine, based on that, numbers of infected mosquitoes, who fed on what. What you see here is that the two species didn't care much whether they were on a dog or not, but they did sort of care if they were on a dog or a cat. So there wasn't a difference in their feeding in the dog. There was a difference in their feeding in the cat, and there was a profound difference in their feeding habits on dogs and cats. So when you factor in the vector and its biological characteristics and host prevalence, along with other factors, can have huge effect on the prevalence of any infectious agent, in this case, heartworm. So in the mosquito, things happen pretty much the same in the dog or the cat, regardless of how you're tracking infection through the life cycle. So it doesn't matter. You might have a different species or two of mosquitoes that are predominant in transmitting, but they still develop from L3, or from microfilariae to L3. Once they enter the host, whether it's a dog or the cat, things at least early on look pretty much the same. So they molt from L3 to L4 in 1 to 3 days, and then from L4 to immature adults somewhere between 50 and 70 days during their immigration to the heart. This is where things change, folks. In the cat, what happens is just very few of those immature worms that arrive in the heart and lungs at about 50 to 70 days mature to adult worms. Most of them actually die as larvae, or excuse me, as immature adults in the lungs, and at that point induce a very unique disease that we've reproduced experimentally, and I'll show you later. There are a few worms that mature to adult that might be short-lived, and when they do die, can induce pretty severe disease and responses due to the thromboembolic events, the inflammation that causes. So you have two forms of disease here. You have disease caused by adult worms that have matured, that reside in the heart, subsequently die, fall into the lungs and induce inflammation in the lungs. And then you have these immatures that never mature to adult worms that die in that battleground that we call the lungs and create this immature infection and disease that we call heartworm-associated respiratory disease. So you admit that it is a bit different than what we see in the dog. This shows you what I just discussed, only in a little bit of a different way. So here's the chronology in this direction. Here are the days in this direction. What I want to show you is this right here. So in the cat, you'll not likely see an antigen until about 180 days. Microfilaria usually follows detection of antigen. Microfilaria persist usually not more than 1 to 2 months in the cat. In the dog, even in the absence of adult worms, this can go on sometimes for 24 months. So cats do have the capability of eliminating microfilaria very quickly with their very active immune system, which compounds our diagnosis again. And the same is true for antigen tests. The period of time that antigen is going to persist in the serum or plasma of cats, or the whole blood of cats, is going to depend on a number of things. How many heartworms, how many female heartworms, ages of female heartworm, how quickly that cat eliminates antigen from peripheral vascular system. So lots of things can determine how long we see microfilaria, when we no longer see them, and the same is true for antigen. So this is something that I published, folks, a few years ago, but I think the information in it is still accurate. What I did was try to compare briefly canine and feline heartworm. And so we'll go through these and just make mention in bullet point fashion of how they might differ. So the dog we know is highly susceptible to infection, the cat less so. We'll show you that in just a minute. We usually see many worms based on fruitful experimental infections in dogs. and cats, we're lucky to get back 10% most of the time. Disease in the dog depends on a lot of things: size of the dog, number of worms, exercise stress placed on the animal. In the cat, doesn't seem to matter. In many cats, few worms, when they die, can cause severe disease, or few immature stages that die in the lungs can cause AHARD and observable, visible signs of respiratory disease. So we say in the past that worms were long-lived in the dog, worms were short-lived in the cat. But let's look at a few of these things in question. So I had the unique opportunity not too many years ago of experimentally infecting dogs and cats with the same isolate of heartworm at the same time, and going in and harvesting heartworms and comparing them at the same time. And this drives the point home, or several points that I just made. So the age of worms when I went in and looked at them was 180 days in the cat, 175 days in the dog. We gave the cat 100 infective larvae, the dog 50, and look at this maturation rate. 6 males, 4 females for 10% recovery rate in the cat, 17 males, 15 females for a 64% recovery rate in the dog. Look at the size of these worms. So this is mean length in the male, mean length in the female. So if you compare these two figures, you can see that heartworms are in fact smaller in the cat than they are in the dog. And that's a common observation that we see with parasites. The smaller the space, the more parasites, the smaller the worms tend to be. Just sort of an observable fact that we see all the years. So this is something that Claudio Ginchi and the Italians did not long ago that I thought was really interesting. They followed over 40 cats, naturally infected cats, through their infections and tried to demonstrate in any way possible when they lost their infections. And it sort of disproved a few old points and sort of proved some additional new points. So look here, the mean survival rate of heartworms in naturally infected cats was over 33 months. Some of those heartworms lived 49 months, over 4 years. So clearly, this may sort of counter our estimate, our point that heartworms in cats tend to be short-lived, less than 2 years. That's probably not true in many natural infections. Dogs are usually microfilariamic, and in our laboratories and natural infections that we've observed, if they haven't received anything to impede microfilarial development or eliminate them, they're usually microfilariamic. Cats usually aren't. I say to senior students, you see microfilaria in a cat, give me a call and we will have a root beer over the telephone. In the dog, heart and lungs are infected. In the cat, it's predominantly a lung disease. You would all agree that heart infections in the dog generally are easily diagnosed with an antigen test, sometimes confirmation of microfilaria, less commonly than it once was when heartworm was more common than it was, but still more easily diagnosed than the cat. Cat usually requires multiple tests. More about that in just a minute. And then we get to the particulars. Treatment certainly is available in the canine in the form of the organoarsenicals of imiticide and diarban, melarsamine. In the cat, we don't have that luxury or that option. We know that the use of an organoarsenical in the cat is not a good thing and will result in a significant number of cats succumbing to the arsenical. In the dog, we see infections outside the cardiopulmonary tree, really less commonly than we see infections outside the cardiopulmonary tree in cats. Cats, because they're not as well adapted a host as the dog, tend to present more times with ocular CNS disease, peripheral vascular disease, abdominal infections, and the like. And of course, the key is that preventives are readily available for the dog and preventives are readily available for the cat. If we could just perhaps convince our cat parents to adopt those strategies and use them with more compliance. So I get asked oftentimes, what causes heartworm disease in the cat? In the dog that harbors live heartworms, their presence in the heart and lungs will induce villus endarteritis, internal villus arterial disease, perivascular disease, interstitial disease, even though worms haven't died. But in the cat, we think that as long as worms are alive, we don't see profound disease or evidence of disease or overt disease. It's when we see dead heartworms, either immature heartworms or adults, that bad things start to happen. We don't believe, since so few cats are microfilariamic, that microfilaria participate in the disease process. We do know that the cat's immune system is exaggerated in its response to heartworm and a number of other agents. So we think this combination of dead and dying heartworms and an overactive immune response probably plays the primary principal roles in disease and disease generation. I mentioned cable syndrome just to say that we do see it in the cat, but rarely, very rarely. That's dependent upon high burdens of parasites, heartworms, and we just don't see that often in natural infections. We can induce it experimentally, but it's just not something we see very often in the cat. So this is where I think those of us who have worked on heartworm for many years went wrong early. And that was trying to convince maybe veterinarians and pet owners that cats die from heartworms. Well, cats do die from heartworm, but the per acute presentation, the fact that a cat presents to you is all of a sudden dead and has heartworms is really far less likely than a cat presenting to you either with heartworms but asymptomatic or with this chronic presentation, probably associated with intermittent worm death. So they go through intermittent periods of dyspnea, gagging, coughing, vomiting, and then get better, return to normal for all practical purposes. So the asymptomatic heartworm infected cats, certainly the most common, and Ray and I probably put that at probably greater than 90% at any one time. And then the second most common event or presentation is this sort of chronic vomiting or intermittent gagging or gasping or intermittent acute respiratory distress. And this per acute disease, sudden death, is really uncommon compared to the other two. So I think we made a mistake early on by trying to convince the veterinarian that sudden death was the major presentation. So this is from my good friend Clark Atkins' work. I think in this study, he examined 50 cases and looked at the presentation of cats in these 50 cases. So what I want to show you is that I mentioned previously that cats with heartworm are going to present with sort of triad of predominant clinical signs, and that would be difficulty breathing, cough, or frequent vomiting. And that's exactly what he saw in this study. Sudden death was observed in his study of the outcomes, but it wasn't as common as this sort of three major presenting clinical signs. This is another thing that interested me in his work. So when he looked at mean survival days, that's how long cats lived, with different cardiac, cardiopulmonary diseases, what he saw with heartworm was surprising. So if you look at cardiac hypertrophic cardiomyopathy, asymptomatic hypertrophic cardiomyopathy, congestive heart failure, this is cardiomyopathy with systemic arterial embolism. This is arrhythmia. This is high blood pressure. And when you look at heartworm and survival days, look at this. When you look at all heartworm, it's much, much lower than when you look at heartworm that have survived past the day of diagnosis. So what's the reason for this? Well, it speaks to the idea of a veterinary patient relationship. If you know those heartworms are there, even if you can't treat them, can admonish the client, can develop a strategy if the cat does develop an acute event or presents repeatedly for, I think, supportive therapy. And this graphic speaks to that. Monitor heartworm in the cat, stay connected with the client and their infected cat, and the survival rate will be much longer. Okay, so let's explain to you what Ray and I researched in terms of immature infections. We were seeing a lot of cats that presented with asthma-like symptoms that were antibody positive, but were not antigen positive. We couldn't demonstrate heartworms using ultrasound. And that led us to make a few presumptions. And the first was this: heartworms arrive in the lungs at that 50 to 70 day period. What the cat does is react violently in many cases to these dead and dying worms. And when those worms die, they create an inflammatory focus in the lungs. And this can be manifested by signs of pulmonary disease, much like you would see with feline asthma or other causes of pulmonary disease, other infectious causes of pulmonary disease. More on this in just a minute. What Ray and I asked was, can we reproduce this? Can we prove to the practice community that this does exist, and how do we do it? So if we look a bit, let me go back here. If we look a bit at this mechanism and we wonder why all of this happens, a lot of it has to do with events, inflammatory events in the lung. And the principal leader in all of this is what we call the pulmonary intravascular macrophage. This is a unique inflammatory cell, not seen in all host species, seen in cats, and thought to, when excited by heartworm or other infectious agents, releases a number of pro-inflammatory mediators like prostaglandins, thromboxanes, and interleukins. And that's what's responsible for a lot of the lesions and signs of disease that we see. you guys might have heard Ray and I talk about PIMS, P-I-M-S. That's just the acronym for these pulmonary intravascular macrophages. So how do we convince you that immature heartworms that arrive in the lungs at 50 to 70 days can induce disease? Well, we did it like this. We chose ivermectin at a dose of 150 micrograms per kilogram every 2 weeks from their near arrival in the lungs throughout the study. So the whole idea is that worms are going to die in this period of time right here. And if we can induce diseases that for our lesions and signs of disease that for all the world look like heartworm, look like feline asthma, that couldn't be confirmed to be heartworm by most tests, then maybe we could convince the practice community and the parasitology community that HARD, heartworm-associated respiratory disease, is a real thing. So that's what we did. 150 micrograms per kilogram every 2 weeks from day 70 to day 220 in attempts to kill these larvae at that key window or that time period between 70 and 90 days and reproduce what we think is going on naturally in the field in cats with heartworm-associated respiratory disease. So did we do it? Well, this is a normal arteriole in the cat. This is the lumen. This is the periarteriolar tissue. The inside of the wall is the intima. Then you have a tunica media muscle layer, and then an outside layer. This is a cat that we interrupted infection using ivermectin. So these started at day 70, I showed you, and then continued until the end of the study. These cats had no adult worms. They had no evidence that worms had ever gotten to the heart, and we induced this lesion. This is animals in our control group that we did not abbreviate infection. So some of these cats went ahead and developed adult worms, but most of those worms died naturally due to what we call natural HARD. And you can see the similarity here in these arteriolar lesions. And look here, this is the alveolar septa here in the control and the HARD cats. They look essentially the same. And this is exactly what we see in a naturally infected HARD cat. And I'll show you that in just a minute. So we think that we did, in our induction of heartworm-associated respiratory disease, replicate the disease. And we concluded in our first publication on HARD that elimination of immature heartworms at about 70 days, so chemo-reduced infections, induced this HARD lesion. Later on in our studies, we added a preventive group and also tried to abbreviate infections with heartworm. And our intention was to show that prevention actually prevented the development of HARD, and it did. And you probably say, well, that's a no-brainer, Blagburn. You can sort of figure out that that was likely to happen. But until you prove it, folks, it's just a matter of speculation. So we concluded that experimentally induced HARD, ivermectin-induced HARD, could not be differentiated from heartworm without induction of HARD. So here's a normal cat lung, cat on prevention. Here is an HARD cat. So these were abbreviated infections. Worms died somewhere between 70, 90, maybe a little more than 100 days. And so you can see the severity of the response here. If you compare an HARD cat, no adult worms in the heart, none ever arrived. This is a chemically abbreviated infection intended to replicate what goes on in the wild, to a natural heartworm infection. You can see the similarities in this lateral radiograph. So we were seeking additional proof. So we went to the literature and we ran upon Dr. Brown's work. Dr. Brown's at the University of Florida, was at the University of Florida. And so she had the opportunity to do this. She had the, whoops, let me go back here, sorry. She had the opportunity to go to the shelter and to draw blood, do antibody tests and antigen tests on shelter cats. And then for those that she was allowed to necropsy, she could go in and actually count or identify heartworms that were present. So here are the results of her study. Remember this lesion? This is what she was looking for in the necropsied cats. Evidence that she had microarterial disease caused by death of young worms, could be adults in some cases too. So look at her categories. This is frequency of this lesion in shelter cats. If they were negative for heartworm, none in the heart, negative for antigen, and antibody negative. Look at the number of cats that had this lesion. Look at the number of cats that were heartworm negative but were antibody positive. 50% that had this lesion. Now, if they were heartworm and antibody positive, you can see that most of the cats had that lesion. That's because this would be a combination of adult infection and HARD in this group. We think this group of shelter cats represents a naturally occurring HARD infection in the wild. Very, very interesting. So Ray went on in some of our follow-up studies to look at the persistence of lung pathology or pathological changes as it correlates to antibody responses. And what we concluded from this work was that the lesions induced by heartworms and HARD persist long after antibody tests go negative and after any evidence based on bronchoalveolar lavage and cytology there would indicate that heartworms are present. Look at this. This is the number or percentage of antibody positive cats. This is the time in months after HARD. So you can see here that here, half the cats are antibody negative. You still see lesions. 4 in 10 cats were still antibody positive here. 6 in 10 cats are negative. You still see out here, 1 in 10 cats was antibody positive, but you still saw evidence on airway histopathology and arterial histopathology that lesions were still present. So persistence of those lesions impressed us too. Randy Winter was a graduate student here at Auburn. He wanted to look at whether or not HARD had an effect on heart remodeling or heart structure. So you all know that heartworms can cause right ventricular enlargement, hypertrophy. He wanted to know if HARD, even though worms aren't found in the heart, if HARD could affect a structural change in the heart or effect on the heart's proficiency or efficiency. And what he concluded was that although heartworm infected cats, this is HARD, did not develop hypertrophy, they did suffer from some loss of myocardial collagen. So the heart, even though worms never got there, and we abbreviated infections, still reacted to the inflammation in the lungs by undergoing some structural remodeling. Very interesting to me, folks. So moving on. Now things don't look so good because we're going to talk about diagnosis and what we can use to confirm the presence of heartworm in cats. So certainly you'd all agree that being in a region where heartworm is very common, a cat presenting with evidence of cardiopulmonary disease or respiratory disease in the form of coughing or gagging and this vomiting accompanying those other two clinicals certainly could lead you to suspect heartworm as a cause. And our mainstay, of course, is antigen detection. Antibody testing is used as a support because it's indicating to us that the cat has seen infective larvae, and those infective larvae migrated from the site of introduction toward the heart at least far enough to induce an antibody response. The problem, of course, is that cats have very small worm burdens, so they're more likely to have single-sex infections or small females not producing a lot of antigen. So the antigen test and the sensitivity of the antigen test is reduced in the feline arena. We're going to come back to this in just a minute. Obviously, imaging in the form of radiographs can help, but it's not specific. More about that in just a minute. Echo is a dead giveaway. If you can see worms in the heart or in the heart and lungs of a cat, certainly easier than the dog, but not a given all the time. Forget about detection of microfilaria for the reasons that I talked about earlier. So many of you are familiar with Wolbachia, and we're going to talk about that in the next slide. But I'll just mention that, of course, detection of heartworms at necropsy is the gold standard, but it's a little bit too late then. So let's talk about this idea of detection of Wolbachia DNA or Wolbachia surface proteins and antibody. Many think that because this little gram-negative bacteria is present in all heartworms need it, it needs heartworm. So they're obligatory endosymbionts, we call them. I tell the students to say that 10 times quickly after a beer on Friday night. But we do know that heartworms require their Wolbachia, and Wolbachia requires heartworm, even if it's nothing but a warm place to live. Why? We don't know. We think perhaps that Wolbachia produces micronutrients or key certain developmental events, particularly reproductive events in the heartworm, that are necessary for it to be present. So you ask the question, if Wolbachia has to be present in the heartworm, wouldn't it be a valid diagnostic indicator or a sensitive diagnostic indicator? And the answer is no, interestingly enough. Most Wolbachia is tied up in heartworms. Now, when heartworms die and they release their Wolbachia, you could detect anti-Wolbachia antibodies, but at this point, folks, it's no more sensitive than detecting heartworm antibodies or heartworm antigen. And we could say the same thing about Wolbachia DNA. At this point, PCR is not going to help us with Wolbachia or with detection of heartworm. So Wolbachia is important. More about that in just a minute. So we mentioned that antigen detection is a principal means of diagnosis, and you guys know that you can send your samples to a reference laboratory, many excellent reference laboratories, either commercial laboratories like Anteg or IDEXX, or state diagnostic labs affiliated with academic institutions, or private parasitology labs and research parasitology labs. And then you have a whole host of point of care tests. And you guys are familiar with all these principal players. 40X Plus, of course, is heartworm plus additional tick-borne diseases. SNAP Heartworm RT, which is a semi-quantitative test. It gives you a low antigen, high antigen positive. Feline Triple, of course, allows you to detect heartworm antigen and antibodies or antigen to the more common retroviruses. Enhanced Witness is Zoetis's more recent contribution to heartworm diagnostics. And then you have other players in addition to the well ELISAs. Our laboratory and most reference laboratories use well-based photometric ELISAs because of their improved sensitivity. So you have a number of point of care tests out there. And the way they work, folks, is here's heartworm. That's the round circle heartworm antigen. These are antibody binding sites to heartworm antigen. Anytime you introduce an antigen into a host, the host produces antibodies against it. Most of the time, that doesn't matter because the antibodies bind only to a few of the binding sites for antibody on the antigen. So it still allows us to trap that antigen and to demonstrate the presence of heartworm. The problem comes when antibodies exceed in their numbers the number of binding sites for antibody on available circulating antigen. So all of the sites become occupied, and our ability to capture down here that antigen and demonstrate its presence is blocked. That's why we call this phenomenon antigen blocking. You guys have all heard about it. When you snap the snap test, you add a wash step, you simply wash everything away and you get a false negative. What we can do, and if any of you are interested in these detailed procedures, you can contact me or you can contact any of your Merck representatives because they have this information that I've provided to them. We have a detailed procedure, as others do, of heat treatment. So if you heat serum or plasma to 103, 104 degrees centigrade, what happens is that the antibodies that are bound to the antigen, which are heat labile, are destroyed. The antigen is a more heat stable molecule. So when you respin your sample and you draw an example from your sample from your supernate, this is all the glump, the coagulated proteins in the bottom. When you sample that supernate, you can then run it against your antigen test, and those opened antibody binding sites will allow you to trap your antigen and demonstrate the positive. So heat treatment has brought with it some confusion. In the dog, people ask me, so do I heat treat every negative dog? Of course not. You heat treat those samples for which you have a suspicion of heartworm. Microfilaria in an antigen negative dog. Dog that presents with clinical signs, particularly from or in an area where heartworm is prevalent, but you have a negative antigen test. When you have a discrepancy in antigen testing, so you send a sample to a reference laboratory, you get a positive in your point of care, they get a negative. I mean, that's a call for heat treatment. And most of our colleagues at the reference laboratories will suggest that you heat treat. And then if you've had a long lapse in prevention, it might be a good idea to heat treat a sample. We're going to answer the question about cats in just a minute. So Dr. Starkey and I here at Auburn, we're interested in whether or not you could achieve this antigen reversal by using acid instead of heat. And so we use trichloroacetic acid. And in our studies, it worked just as well as heat. So why would anybody care about acid? And is it likely to be included in a test in the future? And the answer is you can use much smaller volumes of blood with acid than you can with heat, or you need larger volumes with heat. And that is particularly important in the cat. And yes, this step is likely to be included in a number of future antigen tests and antigen test platforms. There's some interest in the inclusion of that acid reversal step, or reagent-based reversal step. So what happens in a shelter? This is some work that we did with Jeff Gruntmeyer when he was in Susan Little's laboratory. So what happens when you draw blood from shelter cats, and then you run an antigen test on it, and then you heat treat that same sample, and you run an antigen test on it? What is your increase in positive numbers? Well, in this study, 385 samples, we went from 0.5% to 5.9%. Folks, that's 1,000% increase. So if you have a suspicion of heartworm in your area and you get the opportunity to do a heartworm antigen test, I think particularly in regions where heartworm is common, it might be a good idea to perform a heat treatment reversal. And most of you are sitting out there saying, and I certainly understand, why do I want to know? I can't treat it. Well, knowledge is power, and we'll tell you in just a minute about what you can do with that information about pod cat. So just to mention imaging for you, and to remind you that in most cases, it's rather nonspecific, except for echo, of course, and to bring up a few points that I bring up when we're talking about diagnosis. Radiographic lesions oftentimes aren't found in asymptomatic cats. Lesions aren't specific for heartworm disease, either in the dog or the cat, although they're more specific for heartworm disease in the dog than they are in the cat. I will grant you that. In feline infections, we see pulmonary arterial enlargement in only about 50% of our severely infected cases. And these radiographic lesions may be transient. They may, after a while, go away until another challenge and another HARD event occurs. And of course, echo is much more sensitive than radiography, but it does require a particular skill set. So I've summarized all this for you guys. What about an antibody test? Doesn't confirm disease. A positive increases suspicion. A negative might reduce suspicion, but it doesn't help a lot. Has to be used with a lot of other information. An antigen test detects only mature females. A positive confirms that they're present or were in the recent past present, and certainly reduces the index of suspicion. Radiographs are subjective and non-specific. Certainly, if other aspects of the history go along with it, radiographs can help you zero down a diagnosis of heartworm. And of course, echo, if you see worms, confirms infection, but the accuracy depends on the skill of the operator. And I've had the distinct pleasure of working with some of the world's best ultrasonographers and heartworm experts in detection. And one of them is Clark Atkins, who, in my opinion, historically is one of the best in the world at detecting heartworm radiograph. So I'm not going to go through this diagnostic algorithm. The reason I show it to you is moving from antibody through all your tests and different routes to get to a positive or a negative. What is recommended regardless of the route you take? Start preventive. So preventive is becoming the new mantra. Well, it shouldn't have just recently become the new mantra, but it's certainly with the products that I'm going to show you in just a minute, should become the new mantra. So here's where things get a little more disappointing, discouraging. So you say, Blagburn, you confirm a heartworm infection, and then you tell me that we can't treat it with adulticide, that we're in most cases going to just watch and wait, or treat clinical signs symptomatically. I think knowing is very important. If the client knows they have a heartworm infected cat, you can certainly get that cat on prevention. You can inform them what to look for in the case of an acute event. Remember Clark's graph, you get most of those cats to a criticalist soon enough, we can save them. So knowing is powerful, even though we can't at this point do anything about it. We can prevent it. A little more on that in a minute. So no, you can't use adulticide in these cats. Dr. Starkey and I are very interested in this sort of slow kill strategy, and we have a little experience with a few clinical cases, but we're likely to get some funding to look at this in the cat in the future and see if we can get to a safe, more effective way of eliminating adult worms from a cat in a slow kill strategy. Right now, not too confident, because remember, only bad things happen when worms die. So we'll see. Certainly right now, your symptomatic therapeutic armamentarium would consist, depending on how severe the cat is, corticosteroids, conservative fluids, oxygen if needed. We normally don't use anti-clotting medicines in the dog, but I think clopidogrel or Plavix is sort of gaining some traction in the treatment of acute events and acute heartworm infection, mostly because the small size of the cat can, in some cases, justify its expense. So we've talked about prevalence, and we really don't know how common heartworm is, no matter where we look, because of the diagnostic test dilemmas we have. We've talked about differences in life cycle behavior. We've talked about differences in disease and explained the uniqueness of HARD. We've talked about diagnosis getting better, but still now problems with the so-called antigen blocking phenomenon and the necessity of heater chemical treatment. We've said that treatment still the least favorable option and is not going to get us, in most cases, to a healthy heartworm-free cat every time. So now we're going to mention prevention, and here, folks, are the changes. And we're going to talk about briefly some intestinal parasites and ticks, because the newer products are giving us some efficacy against these parasites as well. So I introduced you to CAPSI and American Heartworm Society at the beginning of the talk. I want to revisit this and just remind you that CAPSI, the organization that I sat on the board, and American Heartworm Society, my friends and colleagues there, all recommend the use of preventives in the cat. There seems to be a consensus justification for the use of preventives, mostly now because of their emerging broad spectrum nature and the fact that they don't just prevent heartworm, they prevent heartworm well, and you'll see that in just a minute. They also take care of a number of important ectos, some ear mites, ticks that transmit important tick-borne diseases in cats, and of course, fleas, along with intestinal parasites. So here are your options. And what I've done for you is I've arranged the groups into the history, and I've been around to enjoy all of them. The first generation, the second generation, the third generation. So the first generation were the narrow spectrum, single entity products that usually only affected heartworm and a couple of IPs. And then along comes the second generation. These are newer generation single entity products like selamectin. Revolution probably did more in the cat than anything at the time that it was introduced. And then we, of course, enjoyed some combi products that increased our spectrum of activity by combining macrocyclics, either with single spectrum flea control products or with pesticides like praziquantel. But folks, here is where the new action is, and it's getting better all the time. It's what I call the new super combis, and we're starting to see them even in dogs with the introduction of some of the newer products. And I think most of the pharmaceutical companies are developing feverishly in this area, but we have some good stuff here right now in the form of Rev Plus, which is selamectin ceralaner, and the newest to enter, which is moxidectin fluorolaner. And we had the pleasure and opportunity to work with this, and I'll show you in just a minute some of our work. And what we've done here is we have the advantage of spectrum and we have the advantage of residual. So we're getting to the point where now just have to administer every 2 months. And I'll show you that in many cases, it's likely that protection exceeds 2 months. So why moxidectin, which you note back here is the active ingredient here, and in some of these other molecules? Why is it touted as being more residual, perhaps more potent? Because it is. It's lipophilic, has strong affinities for its receptor. It has great sensitivity in its mode of action, and most importantly, its spectrum and residual. So what I've done here is showed you a decay curve for ivermectin-like molecules in the form of iprinomectin, and the decay curve for moxidectin, in this case in BRAVECTO Plus and Advocate, which is the European version of Advantage Multi. So look, here's the scale in days up here, up to 12. Here's the scale in days down here, up to 100 almost. So you can see by the decay curve that moxidectin just stays around longer. It's a more potent molecule because of its, stays around because of its lipophilicity, and probably has some unique features in its elimination characteristics too. So certainly there's a reason why it's sort of emerging as a market leader in terms of active ingredients. So let me tell you a little bit about how we evaluate heartworm preventives. So historically, what we would do is we would infect, and then 30 days later, we would treat. So we're evaluating the drug that we're evaluating against 30-day-old larvae. Well, that doesn't work so well when you're looking at a product like BRAVECTO Plus that has residual activity that stays around and exerts its effect longer. So we have to do that a little differently. We have to administer the heartworm product before we challenge with larval infection. And here's how we did it. So we have three groups here, 1, 2, and 3. So the control group, group 1 and group 2, are treated on day 0. Now the control group doesn't receive active drug, it receives placebo only. Group 2, treated on day 0, is going to tell us whether or not BRAVECTO Plus is effective for 3 months, because we're going to challenge out here at day 90. Group 3, which is going to give us information about 2 months residual activity, is not going to be treated until day 30. So you get the reason for the setbacks here and the information that we're going to glean by experimentally infecting after we've already treated. So what did we see? Wow, these are very interesting results. So my pivotal study is in blue. The second, or sister pivotal study, is in red, conducted at a different laboratory. So you can see that both laboratories got 100% efficacy 60 days into the treatment process or challenge. In our laboratory, we got 100% efficacy against our experimental strain of heartworm at 3 months. In the sister study, 3 cats out of 10 had 1 worm each, so efficacy was reduced to 93%. So this is the reason that BRAVECTO Plus carries the 2-month label claim. Doesn't mean that it doesn't have superior activity out to 3 months against fleas, and even in many cases, probably activity out to 3 months against heartworm. It simply means because the mandate from FDA is that you have to be 100% to get a claim against 3 months. The heartworm claim ends at 2 months. But let me show you something. I've done a lot of work with moxidectin, and I know that if you infect a dog here with heartworm and you treat it 30 days later with moxidectin, a rather low dose, that you'll be 100% effective. If you treat it at day 60 after infecting here, you'd be 100% effective in the dog. My point here is that I'm not telling you that this product should be approved for 3 months. I'm telling you that if approved 3 months or 2 months and used, you have quite a bit of latitude in terms of non-compliance for the client, because since it kills 2-month-old larvae that might be present at the time of treatment and works outward for 2 to 3 months, your activity against heartworm really spans a 4 to 5 month period. That is powerful when it comes to heartworm, particularly when it comes to compliance. So you see, these new products are really providing some very interesting new results to us. So let's talk about IPs. We're nearing the end, folks. I certainly appreciate your patience. And again, going back to CAPC's recommendations and our strategies at Companion Animal Parasite Council, we believe that cats ought to be on broad spectrum heartworm preventives, intestinal parasiticides year-round, because even peri-domestic cats, cats that go out briefly, go out only to the patio or deck, are still susceptible to intestinal parasites, because many of the parasites that infect the cat are transmitted by a multiplicity of paratenic or transport hosts. And these transport hosts can exist in the house and in the peri-domestic environment. So since these newer products protect against fleas, ticks, IPs, heartworm, it's becoming a no-brainer. I don't see how the client could refuse the strategy. We did a national survey of shelter cats just recently, 4,143 of them, and we looked at how many had roundworm and how many had hookworm. So look at this. The nation, almost 20% of the shelter cats that we saw had Toxicara. In the Northeast, 27%. So you folks up in the Northeast beat us folks down here in the Southeast in terms of Toxicara. And what impressed me is the consistency of the prevalence of Toxicara across all regions. And the reason for that is because Toxicara is acquired in most cases by paratenic host ingestion. On occasion, it can be transmitted in milk or colostrum, but those are fairly unique events. So look at the hookworm, prevalent in the Southeast, but diminished in prevalence in other regions. This is simply because hookworm larvae do not tolerate cold weather. Even though this parasite uses paratenic hosts, the number of viable larvae that those paratenic hosts can see is greatly reduced in climates that aren't mild. So this parasite is going to be elevated in the Southeast. This parasite is going to be present just about universally wherever you go. All right, I want to revisit this lesion. Remember that? That's that HARD lesion, that medial hypertrophy and enamel proliferation and perivascular inflammation that we saw in HARD. Do you know that if you experimentally infect cats with Toxicara species, you can induce that lesion too? So if you go back to those shelter cats in which they had the highest prevalence of this lesion in them, it probably reflected some HARD, some adult heartworm infection, and some intestinal parasite infection due to migratory ascarids. Another reason to control intestinal parasites. So I put this slide on here because I'm often asked, is it important when the pharmaceutical companies come in and tell you that their product is effective against 4-stage larvae and immature adults? Is that a meaningless claim? Is it just allow you to check more boxes? Is it really important? I happen to think it is. Why? Because the earlier stage that you affect, the longer it takes those earlier stages to mature to adult. So your period of egg shedding, protection from environmental contamination is longer. So anytime you can kill more parasites and earlier parasites, it's better. I think it's important. So I attended AAFP, one of the last meetings, major meetings that I attended before COVID hit, to present out there and talk to my friends at AAFP, and they informed me that at that time they had just published their new guidelines, which in terms of feline zoonosis, certainly strongly recommend consistent deworming and prescribed vector control. And if you look at their website, they talk a good bit about Toxicara cati and its dangers. So it is important, I think, to concentrate on intestinal parasites, seemingly in a host like the cat, where you wouldn't think that they would be as common as they are in the dog. So this is not my study. I just wanted to drive a point home. I've done a tremendous number of flea studies, but not this one. So this was a BRAVECTO Plus study looking at experimentally induced flea infestations and looking at residual activity of in this case, Floralaner in the BRAVECTO Plus formulation. And what it shows you is that, remember, they have a 2-month claim, so you're well near 100% at 2 months, but still above 90% would be sufficient for a label claim at FDA if it were a flea product only. In fact, they get efficacies like that in their existing BRAVECTO product. So you get certainly 3 months against fleas. I showed you the data in which you get a significant percentage of heartworms eliminated all the way out to days 90 and 91. I'm not encouraging you to use it off-label in that fashion. I'm just telling you that it empowers you with more trust. If clients are non-compliant, it sort of helps you to provide that protection. And the same thing is true of ticks against, in this case, Ixodes scapularis, black-legged tick, and Dermacentor variabilis, American dog tick. Efficacy is profound through day 62 and starts to wane just a little bit, in this case against American dog tick, Dermacentor species. Remains very high against black-legged tick through 3 months. So the message for all this, folks, is, by golly, you're approaching 3 months in efficacy here. And so feel comfortable about 2 months and feel comfortable if compliance ever becomes an issue. So what can we conclude? Well, we don't know what the true prevalence of heartworm is. We don't know what the risk factors are. We don't know when cats are going to see heartworm. So place them on preventive. We know that diagnosis is difficult, usually due to low worm burdens, the more likelihood of antigen blocking, the necessity of heat treatment. We know that we can't use an organoarsenical to eliminate adult worms. We are working on slow kill. That may help us in the future, but we don't know. So prevention is the key. And these newer preventives are getting us closer, folks. Much, much closer to what I think is successful, comprehensive feline parasite control. Remember that first graphic that I showed you? Opportunity. Pet owners are aware that some of these parasites are greater risks, seemingly, and based on their perception than based on the veterinarian's perception. So let's take advantage of that. And with that, I think we're going to call in Belinda. Are you going to talk about this a bit?
Yeah.
Wait, I guess
Actually,
we wanted to ask questions, right? Sorry.
Yeah, actually, what we're going to do first is open it up for questions. Again, there are 3 ways to ask questions within the chat. Just simply put your question in. We have one question already from Dr. Elliott. You can also send a text message to 412-400-7447, or you can send an email to askcvp@cvpco.com. So those are the 3 ways that we can ask questions. Dr. Elliott, I'll let you go ahead and ask Dr. Blagburn your question if you would like, if you're still on the line.
I am. Thanks so much. So this question came up just yesterday. I have a vet student doing a summer externship with us, and I have a new grad. And we were going over histories from dogs from the South and talking about the possibility of needing to do heat treatment antigen testing on some of them. And so those 2 put their heads together and came back to me at the end of the day and said, why don't antigen antibody complexes happen in response to natural infection, regardless of whether you've had a heartworm treatment? And I said, I don't know the answer to that. And so my question is their question plus, why are dogs from endemic areas who often come through rescue groups who don't follow the American Heartworm Association treatment protocol more likely to need heat treatment antigen testing to pin down their heartworm infection?
Well, Dr. Elliott, that's a great question. Not an easy one to answer, but I think there are a couple of, operatives going on here. Number one, in those regions, heartworm burdens tend to be higher, right? So they tend to induce a more active immune response, a higher antibody response. You know, we don't think about dogs producing antibodies like we do cats because we haven't exploited the antibody response in diagnosis. The reason we haven't is because all dogs would be antibody positive, even dogs on preventive. So I think the higher the worm burden, the more likely you are that you're going to stimulate the immune system. And it just depends on numbers of females, ages of females, amount of antigen that they're producing, and how quickly that dog is getting rid of antigen. Because what happens is blocking occurs when you have more antibody than you have antibody binding sites on antigen. So put simply, more antibody than you do antigen. So that's more likely to happen when more worms might be producing less antigen, but inducing more antibody response, if you see what I mean.
Yeah.
Another thing that they might be doing is placing those dogs on a slow kill strategy. They might be treating with doxycycline, then starting them on a preventive en route to where you see. So we know that after a few administrations of preventive, some of those adult worms start to die. So as those adult worms die, they induce more inflammation, more antibody response. So you increase the amount of antibody, you have fewer adults producing antigens, so you're more likely to induce a blocking phenomenon, if you see what I mean.
Yes.
I think you told me what I should have told you when you asked the question, and that is, shouldn't we probably heat treat every sample coming from an adoption or relocation or rehoming from a heartworm endemic area? And my answer is, if you want to know the true heartworm status of that dog, yes.
Oh, thank you.
Makes sense, doesn't it?
Mm-hmm.
And it makes more sense in the dog than it does in the cat because you can do something about it.
Right.
I still think that knowing in the cat is very important because it can allow you to communicate with the client about what might happen. Does that help a little bit?
It helps a lot. And I'll solidify my knowledge when I repeat it tomorrow to the new grad and the vet student. And then I look forward to telling my colleagues that what we all know, that knowledge is power, but the advantage of knowing the heartworm status of a cat is truly valuable, and I appreciate learning that.
It is, and you know, I give a lecture on occasion called "Heartworms Will Find a Way to Fool You." I've been doing this for next March 1st will be 40 years, so I've seen a lot of cases of heartworm, and we serve as a referee laboratory for many of the pharmaceutical companies, and so we get the toughies, the ones that aren't so easy. And so we have to try to figure out why what's going on is going on. And it's very complicated, extremely complex. Trying to figure out what's going on in every instance is virtually impossible, but we're getting better. The antigen tests are getting better. We know a little bit more about why we're seeing false negatives. The tests are getting more reliable, so we're seeing fewer false positives. So we're moving closer and closer, particularly in the dog, I think, to a battery of tests that's going to be reliable.
Good news.
I don't see any other questions coming in, so I do want to thank you, Dr. Blagburn, and thank you, Emily, for your introduction this evening and for that engaging question. Really appreciate it.